Hi, it's Dr. Matt Harkness with Allied Physical Therapy, and today we are talking about dry needling, and Lorena has graciously said she would agree to be a part of this video. So how are you doing, Lorena?
I'm good. How about you?
Good, good. Okay, so Lorena has some tennis elbow here, and so she has pain on this side of her elbow, and we have done some physical therapy, soft tissue massage, we've done some stretching, we've done some ultrasound, deep heat, and we feel some trigger points here. What a trigger point is, it's basically a aspect of the muscle that's tight, and sometimes it feels like someone might call it a knot. I have a knot in my arm here, and it's painful, it's tender. And so dry needling works very well to remove the knots, and we insert the needle into the trigger point or knot, and it draws in blood flow, helps the area to relax. Okay, so essentially it's administering the dry needles is we find the trigger point area and we just position the needle at the area we want to target, and we just tap it in, and then we just push it into the area, and it feels a little bit, there's a little discomfort initially. Sometimes it can feel like tension, so what we'll do sometimes we'll wind it, and that'll take the tissue at the trigger point area and just allow us to stretch it internally. And so, yeah, it might feel like an ache. And so yes, and some people have different tolerance. Some people say, oh, you can put in a bunch of needles. Other people, they don't tolerate it as much, just like with any exercise. Some people can tolerate a lot of exercise, some just a little bit. So usually I'll put in, depending on how many areas that have a lot of tension or knot or trigger point, I'll insert probably up to 8 to 10 needles. And then we leave them in for a minute or two, and then we simply take them out. And after, we'll do some more work over the area where the needle was. So just once again, the needles are the same as acupuncture needles, but it's a different philosophy. So acupuncture is more meridian channels and energy. Dry needling is essentially to reduce trigger points, reduce pain, and reduce heightened sensitivity due to the nerves being like on. They're just activated with the injury, and they're on a high level of irritation. The needles will reduce the irritation neuromuscularly as well. Okay, so last question, is it covered by insurance? And this particular treatment is not covered by insurance. So we usually determine, is it appropriate? And then we have 4, 8, and 12 package sessions. And again, the goal is to speed up the healing process, to reduce number of visits needed, and being that this would be an appropriate treatment for you, it works very well. Of course, we feel it is worth it. So you can go onto our website. We have many different resources there, different ebooks for different injuries. We have great information about us, our staff, and be sure to subscribe to our YouTube channel, sign up for our newsletter, and there is information in there on dry needling. So thank you for watching, and we will see you at our next video on wellness, and connect with you again.